treatment of major depressive disorder, anxiety disorders, along with other conditions. So Dr. Quinn is here. He's joining us for this week's Focus on Health to talk more about SSRIs. They're sometimes called happy pills. Is that right, Dr. Quinn?
That is correct. Ironically, I had a patient to walk in the room. She said, I was told that you could refill my happy pills here by the pharmacy, Walgreens. And I looked at her and I knew exactly what she was talking about. And then I asked her some questions to establish the diagnosis that she really needed the medication. And she answered all the questions appropriately, so we prescribed the medication. I said, you can go back to Walgreens, your happy pills will be ready for you. And we'll see you back in a couple of weeks to make sure that everything is good. And she was very happy.
Good. Well, how do the medications work?
Well, basically these pills, like you said in the introduction, are called serotonin reuptake inhibitors. And what they do is they work with neuropeptides in our brain called serotonin. And these neuropeptides, what they do is they work by helping us feel a little more optimistic about things if we have a low amount of this neuropeptide in our system biologically. That's why it's so important that people that need the medicine take the medicine, and the medicine not be prescribed to people that don't need it, because not only could it not help them if they don't need it, but it could also be hurtful.
What are some of the concerns with this medication?
Well, like I said before, if you don't need it, meaning that you don't have a diagnosis of depression or anxiety and your serotonin levels are normal, then you could have some of the side effects. And this is a case where the risk would outweigh the benefits, meaning that you could have serotonin syndrome where you could have some numbness, some forgetfulness, and also worsening of symptoms if you feel you have those symptoms as well.
Okay, so let's talk about the recommendations. What recommendations do you have for people that have concerns that they may benefit from these medications?
Don't feel shy to go talk to your doctor. Talk to your doctor, your medical provider, if it's a nurse practitioner or a therapist. But it's best to talk to a professional. Some people just talk to friends, and unfortunately, a lot of communities, they'll say, you don't need any medication. You're not we're not going to use crazy. That's not true. Don't be ashamed. It's okay to talk to someone, and it's very smart because a lot of people are out there suffering, and these medicines can make it better for those individuals.
All right, Dr. Quinn, is there anything else I haven't asked you that you'd like to include for this segment?
Most importantly, don't be ashamed. It's okay to let people know, I'm feeling a little sad right now, but know that help is right around the corner in the form of a conversation with your medical provider.
Okay, we all have our days. It's okay.
Mm-hmm.
Thank you, Dr. Quinn. If you have any questions, again, just go to your doctor.